So everyone, we are very happy this week and excited to be offering you a sneak preview to the NC Child County data cards that will be coming out soon. This is a product that is our most used piece of information throughout the year by advocates like yourself. And Vikki Crouse, who is our KIDSCOUNT project director, has been leading the charge on this and is going to talk about these county data cards and get everyone prepared to use them. We will also be getting a legislative update, our weekly legislative update from our lobbyist, Ashley Perkinson, as well as our policy director, Tiffany Gladney. There's a fair amount of activity in the legislature again this week, and so they will try to get us all updated on legislation related to children and answer any questions that you may have. We will also, at the end, as always, allow some time for any announcements and then adjourn. So thanks everyone once again for joining us. And without any further ado, I am going to turn it over to Vikki Crouse.
Hey, good morning, everyone. I'm going to go ahead and share my screen. So you should be able to see it now. So I am so excited to be talking to you all about the county data cards that we've been working on for the past several months. And it took us a little longer than usual this year because we're releasing for the first time interactive county data cards for you all to use in your advocacy. And the most exciting thing about these is that for the first time, we're going to be offering data that is stratified by race and ethnicity down at the county level. We know how important it is to talk about differences across race and ethnicity when it comes to the different child indicators that we care about. And so to be able to do that at the county level and lift up, the differences that we're seeing is really important for us in our advocacy. Now, I may have been a little bit delirious when I put these slides together, so I even created a mascot, Dan the data hero, because I just really want you all to be excited about data this morning, who wants you to be a data hero by using data in your advocacy. And we'll also be releasing our traditional county data cards that you all are accustomed to seeing that are very printer friendly and downloadable. So you'll be able to find those at the same place on our county data card site. So there's no, big release is not complete without a technical snag. So I know many of you were waiting for our county data cards this past Monday, but due to some technical difficulties, they will be out this upcoming Monday, March 29th for you all to use. And this is just a picture of 4-year-old Vikki reassuring myself that everything's going to be okay, even when we run into technical difficulties. So just a little Friday motivation for you. All right, so let me go ahead and jump into what we're seeing with the 2021 county data card trends. And just a note that most of this data is still pre-pandemic, with the exception of third grade reading scores. Oftentimes the education data, we are able to get that for the most recent school year. And we were able to do that with third grade reading, but not with high school graduation rates because of some COVID-related delays. So, before we jump into looking some of the indicators, I do want to talk a little bit about state demographics because this is so important to the work that we do. So when we're talking about kids in North Carolina, we're talking about more than 2 million kids in our state, and nearly 1 in 3 of them are under the age of 6. So we have a very young child population. And when we're looking at racial demographics, the vast majority of kids in our state are white, closely followed by Black children, and then Hispanic and Latinx children, and then children of other race. And this is relevant because as I talk through these indicators, you might note a sharp increase or decline on any given indicator when compared to the statewide number. And oftentimes those differences are driven by racial disparities. So it's important for us to think about the demographics of, your specific area as we look at these indicators. So jumping into health insurance, we know that the lack of health insurance is a really big driver of hardship in our state. And it's relevant to family economic stability because high medical bills can stop a family from being able to save. But it's also, of course, over the last year, we've seen how relevant it is to public health. In North Carolina, more than 130,000 children have no health coverage at all. And there's wide variances by county. There's been a lot of research that shows that health coverage is highly influenced, children's health coverage is highly influenced by parental coverage. So when parents are insured, kids are more likely to be insured and receive regular health care. And we also know that there are some ties to maternal outcomes, health outcomes, and infant outcomes. So late prenatal care and poor birth outcomes are also linked to health coverage, and we'll be talking a little bit more about that in the next slide. But on this slide, you'll see here the top 10 counties with the highest uninsurance rate for kids. And so you can see, just from the top of the list that Swain County, almost a quarter of kids in Swain County don't have health insurance compared to just 5% overall in North Carolina. And with our interactive county data cards, you'll be able to see those differences by race and ethnicity. And I will note that Latinx children and their parents tend to have the highest uninsurance rates among racial and ethnic groups. Oftentimes, this is affected by immigration status and therefore eligibility to some of our public health, our public medical health coverage programs, I should say. So jumping to birth outcomes, having health insurance is a big predictor of whether or not people who give birth are very likely to have children who are born full term or at a healthy birth weight. And we know that in North Carolina, race is also an important factor when it comes to birth outcomes. Before COVID, nearly 7 infants per 1,000 died before their first birthday in the state, which is terrible. But unfortunately, this is also good news for North Carolina because we recently saw our lowest infant mortality rate at 6.8 per 1,000 deaths compared to the past several decades. But of course, this especially is an indicator that is very different when we're looking at different racial groups, right? For white infants in North Carolina, the infant mortality rate is 4.7, but for Black babies, it's 12.5. So more than double the white infant rate. So there's something different that's happening in the way that Black infants and Black mothers receive care that's leading to higher infant mortality rates in the state. And it's not only health insurance, but that is a factor. So I've listed here on the slide the top 5 counties that have the highest infant mortality rates and those with the lowest. And you'll note that for the lowest, there are 14 counties that had a rate of 0 this year, which means that there were no infant deaths in those counties. But of course, this is an indicator in particular where we see a lot of variance year to year. So it always just kind of changes and depends on different factors. You want to note with these rates, and especially as you dig into some of the racial and ethnic data on the interactive cards, that a county size is really going to influence the rate, right? In a small county, when you have 5 infants who die compared to a large county, that's going to lead to a higher rate. Okay, so let's go on to food insecurity. And we all know that the pandemic has led to a higher demand for food and nutrition support. And we've seen a deepened hunger problem that was already stark in many counties in North Carolina. But before I show you some of the data on that, for us to understand what we're talking about here, when we think about food security, we're talking about families having consistent access to enough food for all household members to live a healthy and active life. The USDA puts together definitions on food insecurity. So what it means to have a healthy life, what it means to have an active life, what enough food is referring to. And they actually create this indicator and this survey that gathers this data on food insecurity. And that's where we pull this data from. So currently, or I should say pre-pandemic, 1 in 5 children statewide were food insecure. So when we look at the county data, we see that the hungriest counties are concentrated mostly in the eastern part of the state. So we're talking about Washington, Tyrrell County, Scotland County, Bertie, Hertford, Halifax, and Edgecombe counties among the top 10 for food insecurity, with Allegheny County in the mountains at number 5. And I'm sorry if I butcher the pronunciation on some of these counties. We do see that urban centers tend to have more access, even if food might not be higher quality there. And that's a general trend that we see nationwide, simply because in urban counties, families might live closer to a food bank or a grocery store. So that's something to consider. And because so many parents have lost their jobs and their incomes, we do expect this indicator to get worse across the board. So not just the places that traditionally have more food insecurity in North Carolina, but really even in those, urban centers where we traditionally see higher rates of food security, we expect, those numbers to be affected by the pandemic. And closely related to food insecurity is poverty. And at NC Child, we measure households with low incomes rather than just, the traditional poverty measure, so just poverty itself. When we're talking about poverty, we're referring to 100% of the federal poverty level, whereas children living in low-income homes are those living at 200% of the poverty level, because we know that even at 200% of the poverty level, families still struggle a lot to pay the bills and, keep food on the table. So at least almost half of kids in North Carolina are living in households with low incomes, and that was even before the pandemic struck. And children that we know are most at risk of living in poor low-income homes include Black and Latinx children, because we're looking at years of historical barriers to family economic mobility, and that we've seen continue over time. And that families and Black and Latinx communities are less likely to, have opportunities to employment with higher wages, less access to trainings for jobs associated with higher wages, and are even less likely to be employed at these jobs, even when they have adequate training. So, there are systemic racism factors at play here that we consider, and that certainly exacerbate poverty levels among certain communities. And then children under the age of 6, because they are more likely to be born to younger parents that are less financially established, are more at risk of living in a poor low-income home. And then children in rural counties are at higher risk, mainly because they tend to lack access to the things that we consider basic needs for families. And you'll see here on the slide, I've listed the top 5 counties with children living in poor low-income homes, and those in more economically secure homes. So Orange County has just a little over a quarter of kids living in poor low-income homes, which is still really high, and yet that's the lowest percentage that we see in all 100 counties. And of course, we have to know how this pandemic has changed and will likely change this indicator over the next year. Next year we'll really be able to see with the data and a more accurate picture of the impact on the pandemic before we saw really critical federal interventions like the American Rescue Plan, which are geared at tackling child poverty. So we'll be able to see in that window of time what the impact was on child poverty in 2020. And when you're talking about these at the local level, consider what's been going on in your county over the past year. Have there been, factory closures and massive job losses that are affecting the child poverty rate in your county? And finally, talking about education, we know that reading at grade level is so important and is a really strong predictor of children's long-term economic well-being and health. So whether a child can read on grade level by 3rd grade is a really vital touch point for success throughout life. Children on track in 3rd grade are more likely to graduate high school on time, they're more likely to go to college, and even earn more later in life. So it's really important. And we know that parents and policymakers are rightly concerned about the impact of the pandemic on children's remote learning and just overall, success in school. But one of the most effective tools that we know for to increase, 3rd grade level reading is school early education readiness, right? So being able to invest in high quality early education is really going to make a big difference for setting kids up for success by the time they reach 3rd grade. So you'll see here the counties that have the highest number of students reading at 3rd grade. who are at third grade level proficiency and those at the lower end. All right. And before I wrap up, I can't leave you all without sharing a preview of our interactive county data cards. Now, we are still, working out some technical kinks, so please bear with me. All right, so it looks like I am sharing you should be able to see the internet page. So here you'll be able to see this is our regular 2021 data cards landing page. And like I said, we're working on the margins, but you'll be able to toggle between the different areas of child well-being that we traditionally see in our county data cards. Now, some of the indicators don't provide data that's disaggregated by race and ethnicity, but a lot of them do. And one other thing that we're really excited about these data cards is that you'll be able to see text that contextualizes some of the disparities that we see in the data. Because we know that when we leave data standing alone, it leaves the door open for folks to fill that in with their own stereotypes or biases about certain communities. And so we don't want to do that. So you can see here at the top, you'll be able to toggle through the different tabs and you'll be able to pick your county. We also are going to have a dashboard specifically for North Carolina. So you'll be able to see that as well. Where you see missing data, it's not an error on Tableau. It's simply that some of this data, we are talking about really small case numbers. So it's suppressed, which means that we've hidden it or the state has already hidden it for us because it's so small. And it can be, tricky to use that data and interpret it and use it in your advocacy when you're talking about a very small number. It gets to be a little bit inaccurate when we're doing that. So did want to share that. And so we're so excited about those. And like I said, they'll look a lot better in the final version. But that concludes our Data County data card preview. And I haven't looked at the chat, so happy to answer questions or can answer them later on, whatever you all prefer.
Vikki, I think you're mostly getting lots of accolades in the chat. So applause, great work. This has been a huge lift and really want to recognize the work that Vikki has done on this. And also behind the scenes, Eva Bannock on our staff, like making this work on the website. It's just a tremendous effort. So thanks, you guys.
Thank you.
Y'all, I mean to say.
Yeah, it's wonderful. Thanks so much, Vikki. And I guess one just thought or question I have is, how can NC Child also potentially support people who want to raise up equity issues within their county related to the data?
Great question. So every year when we release these data cards on the traditional PDFs, on the back side, you'll find those talking points. We highlight health insurance, poverty with talking points and questions for your elected officials. But we're also, for the first time, going to be providing some technical assistance to some of our CAN agencies. So we'll be releasing an RFP for that soon, and we'll be picking a number of agencies to receive that data training. The first training, however, is going to be open to all CAN agencies. So that's going to be focused on data visualization, how we visualize data in an effective way, and again, communicate it in a way that doesn't perpetuate negative stereotypes. So be on the lookout for that. We're really excited to be doing that for the first time. And please let us know if there's any other tool that we could release that would be helpful for you in your advocacy as well.
That's wonderful. Thank you. Have we picked up any other questions in the chat?
Just more accolades. Great job, Vikki. I hope your back doesn't get sore because you need a lot of pats on the back for this. Also want to share with folks that we did put out a toolkit this week that you can use if you want to share these data in your community. It's just a social media toolkit. It will help you write a letter to the editor. We know that there will be some good press coverage of this. So if you see press coverage in your community, that's an amazing opportunity to send in a letter to the editor or an op-ed to say, here's what our agency is doing about these issues at the local level. So we really want to support you to do that. So I'm going to drop a link into the chat for that social media toolkit that you can use to help get the word out starting Monday. So the release is actually Monday. What you're getting today is a sneak preview.
Wonderful. Vikki, thank you again for leading the charge on this. It's super exciting. I know that this is going to be a widely used resource within our network. All right, so now moving on to our weekly legislative update. I have, I believe, Ashley first on our agenda here. So Ashley Perkinson, NC Child Lobbyist, take it away.
Thank you, Adam, and good morning, everyone. So this week we saw the presentation of the governor's proposed budget, and just yesterday, his budget director, Charlie Crouse, provided a presentation to the Joint Appropriations Committee, and I'm happy to go over some of the highlights from that proposed budget. I'm also going to put a link to that presentation in the chat, because not only did it provide the information, of course, on the budget highlights, but it also provided some interesting information on the population growth in North Carolina, and also plans related to next steps for the American Rescue Plan. And I'll go ahead and mention on that front, with the American Rescue Plan, we will see in the coming weeks an additional proposal from the governor for proposed allocations for funding from the American Rescue Plan for those federal dollars. But what we saw released this week, this is for the proposal for the new state budget. And as I'm sure most of you on this call know, each year in the General Assembly, the governor produces his proposed budget, and then the legislature develops its proposed budget. This session, the Senate will be introducing its budget first, and we will see that in the coming weeks. And I understand pretty soon the subcommittees will be getting their target amounts to put together their individual budgets as well. So some highlights from the governor's budget this week. Big investments in education in K-12. We're seeing the proposal that would include an average pay raise for teachers of 10% over the next 2 years. Also, for those individuals who are non-certified public school employees, a $15 an hour minimum wage, $2,000 bonuses for teachers, principals, and non-certified school employees. So that's in addition to the increase that I just mentioned as well, and $80 million to go to more school nurses, school counselors, school psychologists, and school social workers. And as you know from NC Child's legislative priorities, funding for more school nurses has been a priority over the last several years, and we will continue to advocate for funding for more school nurses. So excited to see that funding included in the governor's proposed budget. The budget also puts forward a proposed $4.7 billion bond to fund $2.5 billion for public schools, over $700 million for the UNC system, $500 million for community colleges, $430 million for health and safety projects across state government, and $460 million for parks, zoos, museums, and state historic sites. Something that was discussed during yesterday's Appropriations Committee was with COVID, the numbers of school students and parents and families who've been able to visit our North Carolina resources, state parks, and state museums have been low. And so a lot of emphasis on funding for those resources. Also want to mention, included in the governor's proposed budget is a refundable earned income tax credit that would help an estimated 800,000 low and moderate income families in North Carolina, and a child and dependent care tax credit as well. So those are included in the governor's proposed budget. On the pre-K front, the governor's proposed budget would include an increase in pre-K reimbursement rates by 16% and administrative rates by 4% to increase capacity for expansion and reduce burden on local providers. It would also fund an additional 1,500 additional pre-K slots and provide $10 million to recurring funds to add 1,700 new child care subsidy slots, and $20 million for Smart Start. Emphasis on pre-K and early education in the governor's budget. And not a surprise to anyone, Medicaid expansion was also included in the governor's budget. As you know, that's been a sticking point over the last couple of years between the governor and the General Assembly. But the governor's proposed budget did include funding for in the policy provision to expand Medicaid in North Carolina. So again, I hope you have an opportunity to look at the link that I just shared, because as I mentioned, it does go over these highlights, but also includes some additional interesting points. And one of the things that I wanted to mention that Budget Director Charles Crouse mentioned in his remarks, that we're the 11th largest economy in the nation, and from a population trend, by 2030, the population growth projection is from 10.6 million in 2020 to 11.7 million by 2030. So a significant number of individuals moving to the state. We're one of the fastest growing states in the country, and really an emphasis on investment for our state resources and education and pre-K. So it will be interesting to see over the next few weeks what the legislature does with the budget. There seems to be a renewed interest in the governor and the legislature working together to have a final budget this year. So hopefully we will get a final budget. I just don't know how long it will take. We might be here a while.
Yes.
Yeah, and to piggyback off of that, we actually saw a lot of movement with other bills that we have been tracking. I think the big headliner this week was, of course, the governor's budget. But when you look at some of our priorities on our advocacy agenda this week, specifically when it comes to child safety and child welfare, 3 particular bills that we have some serious concerns with actually moved at warp speed, it seemed like. Senate Bill 69, the DMV licensing outsourced road test bill, successfully passed out of the Senate and is now headed to the House. This is the legislation that we've talked about for the past few weeks, which would change the state's graduated driver's licensing requirements by reducing the amount of supervised time a teenage driver must complete before they can get their license. So this one is now headed to the next chamber, the House, and it is on the Rules Committee's, it's been assigned to the House Rules, so we're waiting to see it get calendared. So we'll stay tuned for details on that. House Bill 247, Standards of Student Conduct, which seeks to make various changes to the requirements for school discipline policies for boards of education. There's also some concerning language in there about corporal punishment and things of that nature. So we're keeping a very close eye on that bill as well. This bill received a favorable report in the House Education K-12 Committee on Wednesday. So that one is moving pretty quickly through the House as well. And then there's House Bill 205, the Abuse and Neglect Resources in Public Schools bill, which also passed out of Education K-12 Committee on Wednesday, March 23rd, and then passed out of the House yesterday and is now headed to the Senate. So at face value, this seems like a pretty good looking bill, but when you really delve into it, it would require schools to distribute information to students at the beginning of the school year. And it would display posters that list warning signs of possible abuse and a phone number to report. But when you really get into the language, it's a lot of self-reporting for students, for children to self-report abuse. So we will keep an eye on that. We are tracking that one and working very closely with some of our coalition partners to see how this bill fares on the Senate side. And when it comes to health, we saw Senate Bill 146, the teledentistry local anesthetic bill, see some progress. This bill would allow dental hygienists to increase their ability to practice via teledentistry. So oftentimes they're required to have a licensed dentist supervise when they're practicing. This one would allow for a dentist to be able to Skype in or FaceTime in or Zoom in or whatever the case may be. But it would also allow them to be able to administer anesthesia as well. And this bill passed out of Senate Commerce and Insurance yesterday. And when it comes to financial security, Senate Bill 114, DES COVID modifications and technical changes, which seeks to make the following changes to the unemployment insurance system, it has 3 specific changes: allow back-to-back extended benefit periods for unemployment insurance claims in 2021, prevent the base unemployment rate from automatically adjusting higher for unemployment insurance taxes due from employers in 2021, and make some technical changes to the current language. So this bill was added at the very last minute to the House calendar yesterday, and it successfully passed its 2nd reading, but it still has to undergo its 3rd reading in the House before moving over to the Senate. So stay tuned for details on that bill as well. And then on the federal side, the Affordable Care Act actually turned 11 years old this week on March 23rd. And to celebrate, we saw that President Biden's administration announced a special enrollment period, which will be extended until August 15th. And the ACA, however you might feel about it personally, the facts are that it has brought health insurance coverage to more than 20 million Americans and cut the nation's uninsured rate in half. And in related news, the U.S. Senate has confirmed a few of President Biden's cabinet picks. So we saw the confirmation of Rachel Levine as the first openly transgender federal official. She is the Assistant Secretary for Health in the Department of Health and Human Services. We saw HHS Secretary Xavier Becerra. I've been working on his last name, y'all, trying to make sure I get it correct. Was confirmed last week. And then, of course, the Senate also confirmed Vivek Murthy as Surgeon General this week. So we've seen a lot of movement going on. So stay tuned. And we're also working on some really cool things to make sure you guys can stay informed and see what we're tracking legislatively without having to just tune in here every Friday, but you can see it in real time. So stay tuned for some really cool updates on that front as well. Happy Friday, y'all.
Thank you so much, Ashley and Tiffany. Do we have any questions that have popped up in the chat?
I'm looking through those. One question that I have, Ashley or Tiffany, I know there was some movement on some of the juvenile justice bills this week, right at the end of the week. And I don't know if y'all have that in front of you, but if not, I can pull that up too. And then we have some comments from Bob Simmons about some proposed rule changes that we need to take a look at. And Bob, if you have a link to those that you can share in the chat, that would be great, because I know folks would love to give comments. Or if you want to just jump on for a second, feel free to unmute and do that.
I'm actually typing a response to Michelle's question.
Oh, great.
It's hard. I'm listening and typing and trying to do all this at once. I don't have a link right now because the date for the vote to approve these changes out of the Social Services Commission to meet the publication deadline was March 24th. So we just barely made it in. This was sort of a rushed process. Most of the changes, as I understand it, are related primarily to updating rules which haven't been updated for many, many years to reflect changes in state and federal law, which are actually already being implemented in practices which are not consistent with the existing rules. So this is an update of the rules to meet some of the practices. It's not just that though. So it really is important to look at these. There were some issues that came up that were related to requirements for eligibility and for information that has to be provided. There's a lot more demand that is being made on the recipients of these services than used to be made under the previous rules. And some of that is not necessarily required by state or federal law. So there are places where we can make comments that will result in the adaptation of these rules to better serve the people who are receiving the benefits by honoring their circumstances, not putting them in a position where they have to provide information that may be difficult. For example, an expectant mother was supposed to, under these rules, have to provide information about the expectant father's resources to determine whether she could be entitled to maternal services funds. and of course, if the father is not involved in her life, the father is not available, the father is abusive. This could really put them in a difficult position. So there are comments that can be made about honoring the circumstances of the people who are recipients and not establishing requirements that make it more difficult or intrusive or denigrating in some ways to people and re-traumatize them through these rules. So it's really important to look at them, and I will provide Adam and Michelle, everybody at NC Child, with a link to the public notice as soon as I have it. Sorry, that was too long, but it's important to look at these. These are meaningful substantive changes that we really ought to be aware of and paying attention to.
Absolutely, Bob. No, thank you for chiming in on that. This makes me think, of course, there's not enough time to do all of the topics we would like to, but I think breaking down the rulemaking process for folks and talking about that and the importance of that could be super helpful, because it's just this realm of administrative advocacy that we don't get into a lot, but can make a huge amount of difference, as you all know. So yes, we will spread the word on that. I'll chime in real quick on the JJ stuff. So the raise the minimum age bill is moving in a couple different ways in the North Carolina legislature. So there was a kind of an omnibus juvenile justice bill that was brought up by Senator Britt, Senate Bill 207, and language around raising the minimum age was inserted into that bill, and that bill passed the North Carolina Senate 45-0 this past week. And so on one hand, that's good. We've got a chamber that has voted to raise the minimum age to 10 years old for children. However, from what I understand, and I don't understand all the details, but that there are folks on the House side that want to change some of that language around to make it a better piece of legislation. Specifically, Representative Marsha Morey, who's a Democrat from Durham and who is really leading the charge on the House side. She has sponsored a raise the minimum age bill in the North Carolina House Bill 261, that is now calendared for the Children and Families Committee, or some kind of name like that, for this coming Wednesday at noon. And NC Child, for example, is one organization will be providing testimony. But the good news is it looks like raising the minimum age is moving forward and has momentum in a very real way in North Carolina. I think now what we're getting into is, what are the carve outs within that? What does that exactly mean? NC Child honestly has said, well, why are kids under the age of 13 in the juvenile justice system at all? There's a lot of evidence that isn't the right thing to do. However, the legislation that's moving is all under the age of 10. So, it's a compromise and something that will be moving forward, but hopefully a bill will be passed, and we think it will be, and it will be as good as possible. And we will keep folks posted on that, because I imagine after the committee meeting on Wednesday, for example, we'll know the next steps. And we may really want to be helpful in pushing this, having an advocacy push to get it over the finish line in a good way.
Thanks, Adam. I am not seeing more questions in the chat. I'll throw in two on juvenile justice. I think Tara Callahan mentioned when she presented to us a bill to end juvenile life without parole. And that bill's been filed. That's House Bill 424, I believe, Representative Faircloth. So also another piece of all of this sort of raise the age kind of work coming together. Really cool. And then I see an update from Ms. Peltzer. Kids Need Two Parents is still waiting to hear whether House Bill 186 might get reassigned and get a chance for a hearing. So thank you for that update. All right, I don't see any other items in the chat.
Okay. Well, thank you to all our presenters today. Wonderful information. Really excited about the county data card release. Please help us get the word out about that. Do we have any announcements before we adjourn? If not, I will also remind everyone about what we have in the works for our weekly updates. Next Friday, Good Friday, we will not be having a legislative update. And then the following Friday, the 9th, we will have an update on child welfare reform. And Karen McLeod from Benchmarks, North Carolina, will be doing that presentation. And that is a convenient segue because on the following week, April 16th, we will be having our Voices for Children virtual banquet that Friday morning. And Karen was a recipient of our Tom V Award in the past. And we will be having new award recipients on Friday the 16th that morning. So please join us for that. I know we've shared the link in past meetings, but the more the merrier. Hope you all can tune in and really get to see some of these wonderful award winners. On Friday, April 23rd, I will also, just looking out a couple more weeks, I think Matt Gross, the legislative liaison for North Carolina DHHS, will be coming on and talking about some of DHHS's priorities for this legislative session. And then on April 30th, we're looking forward to North Carolina Housing Coalition talking about workforce housing, affordable housing issues here in the state of North Carolina. So got a few things lined up through April. As always, please keep an eye out for the recordings, share it with others, encourage others to join us for our Friday calls. If there's nothing else, then we will go ahead and wrap this up. Thank you all for joining us and have a wonderful weekend.